at the Outline Skincare Clinic in Droitwich today to watch a lip augmentation, lip reshaping and enhancement. And our model here has already got lovely shaped lips anyway, but she just wants slightly more fullness in them and slightly more definition on the lip line. The product that we're going to use today is Emervel, Emerval Lip. It's a specific filler designed to be used in the lip area. It's very cohesive and very natural and feels very soft. And the reason that I like this particular product is it lasts well, typically around about 6 months, which is about right for a lip product. But also the fact that there's minimal swelling afterwards, so patients love it because they don't tend to get that bee-stung look for a couple of days after treatment that can be associated with some of the fillers. So I find that the swelling is a lot less, and this is Emerval Lip Enhancement. So the first thing I'm just going to do, Lucy, is make a little hole to pop the cannula through. Okay. So this is a little sharp scratch here for you, I'm sorry. A little scratch there. I'm doing the treatment with a cannula, which is a blunt tube. And the benefit of using a cannula for lip treatment is it reduces the risk of swelling and bruising. And you can see how easily my tube is gliding, and it's already right up to the top here, so we're ready to go. And it's actually more comfortable as well than using a needle. This is the product going in, Lucy, okay? So it's impregnated with anaesthetic. So after a couple of minutes it will start to go a bit numb for you. And that's that edge done. Is that okay?
Yeah, that's lovely. You feel just about the needle going, but other than that you don't feel anything else.
Don't feel anything.
No.
And I don't know whether you can see on the video how it's, when you compare one side to the other, but how it's just defined the edge of the lip there, and that's what we're trying to do. So this doesn't actually make the lips any larger, it just simply defines the edge here. And I'm just going to do exactly the same in the lower lip, Lucy. So strange pushing sensation here. Just making a nice border to give the lips some good shape to work on.
Can somebody just have the border done if they want
They can just have the border. You don't necessarily have to have the body done. If you don't want any larger lips and you just simply want a reshape of the edge, you can. And you can probably see there the definition that it's given her on each side. So I'm just going to swap sides and do exactly the same on the other side, if that's okay. Okay, just tilt your head away from me slightly. Okay, so this is the sharp little scratch again, Lucy. I'm sorry about that one. Well done. You okay, Lucy?
Yeah, with the balm that Mary uses to put on before, it's really helped, and you actually just can't feel a thing at all.
Mm. Okay, little scratch. Weird sensation again, and my cannula is all the way up to the top here, and it really does reduce the risk of swelling and bruising as well. Lips are a very vascular structure. They have very good blood supply, and when we treat with a needle it does have a risk of bruising associated with it, so I do like to do my lip treatments with a cannula.
How long have they been using cannula rather than just needle?
A couple of years probably. I still will use a needle for some of the reshaping in the middle. For fine work I still tend to want to use a needle, but for the majority of it we can use this cannula. Okay. Sorry, Lucy, about this little pushing there. And that's just defined all of the edge for her. So we're ready to do the body of the lip now. And Lucy's just asked for a slight fullness and slight enhancement to the lip. She's got beautiful shaped lips, the top lip being slightly smaller than the lower lip, which is naturally how it should be. So I'm going to start with the top lip, and hopefully I should be able to go in through the same hole as we've gone before. Okay, Lucy? And this will numb in a couple of minutes. And this just enhances the shape and will give hydration. Hyaluronic acid is very loving of water, and it will attract water to the area just to make the lips very hydrated. So great if you suffer with chapped lips at all in the winter. This is a great treatment. Lucy's lips should be feeling quite numb now. I can feel that I just need to put a little bit more product here. Okay. How was that?
Yeah, absolutely fine. Again, I think the anaesthetic balm and the anaesthetic in the actual product, you can't feel a thing.
And smile for me, give a big smile. And can you do a kiss? And can you just sit with your mouth open slightly for me? That's lovely. I'm just going to pop a little bit more product in here. These fine holes can sometimes be difficult to see. There we go. And I just want to fill that bit slightly more there for her.
I think you said this was 1 ml of product. Normally most people have, what, just 1 ml or...?
No, it does depend. This is the first time that this lady's had her lips done, so 1 ml is more than enough for her to see, you know, whether she likes the effect of it. And obviously, if she did want them bigger in the future, we could put more in. But to be honest, most people now are moving away from the large lips that were fashionable a couple of years ago, and it's all about less is more. Okay, Lucy, this is the same on this side. We're just making these lips really nice shape. And can you smile for me? Lovely and relaxed. So we just need a little bit still in there. The beauty as well of using a cannula is you can get your patient to pull an expression so that you can see where you need to be. Can you smile again for me? That's lovely. And do a kiss motion. Lovely, that's great. And I just want to pop another little bit. In there. That's that side done. We can just massage. A little bit of swelling after this treatment is normal, and depending on what lip filler we choose, some do swell more than others. But with Emervel, as I said, I do find that the swelling is minimal.
And how long would that last for generally?
Swelling might last for a couple of days usually, but nothing worse than that. So we're just going to come through now and do exactly the same on the lower lip. Hopefully we'll get in the same hole, but this, to be fair, might have closed up, so we'll see. I might have to recreate the hole here. Sorry, Lucy. Okay. I'm just going to make another little scratch here for you. Okay. And then this is the body again of the lower lip. And this is just going to, again, just enhance what she's already got, which is a lovely shaped lip. Typically this product will last around about 6 months, and it will gradually just be reabsorbed by the body. Okay.
Yeah, absolutely fine.
That looks really lovely and natural.
Can you do me a smile that's lovely? Yeah, that's great. And another kiss like that. Yeah, that's lovely. So I'm going to try and get in Lucy through this hole again, but I may have to do what we did on the other side. Oh, it's not still patent, which it isn't. Okay. Well done. It does numb up fairly quickly with the product, the anaesthetic product that is in here. Patients do say they find it, relatively comfortable to have done. Years ago, lip treatments used to be very painful with needles, but now with these cannula treatments, it is much more comfortable.
And are you just moving the product along there, I notice, with your fingers, or just making sure it's nice, smooth?
I'm making sure it's nice and smooth. It is quite a mouldable product for the first few minutes when you inject it. The lips are very, if you imagine like a natural sponge with pockets, the lips have natural little pockets in where the product tends to accumulate. So I'm just making sure that we don't have any lumps and bumps. But I'll give the lips a good massage before the lady leaves anyway.
And then what would the patient need to do now as like an aftercare with this product? Is there anything they would need to do? Or?
Not really. Don't massage it. You can wear lipstick from tomorrow. Any bruising that is there can be hidden with a dark lipstick. So could you just smile for me again, Lucy? And just sit with your mouth slightly open, lovely. Just going to pop a bit more in here. And then I think these lips are quite equal. And they will look a little bit swollen at the moment from the treatment. We'll just give them a quick massage. And then I'm just going to define the Cupid's bow at the top for Lucy. and give her a little bit of what we call a philtrum ridge, which is these two lines that run from the nose down to the mouth. It's quite youthful. If you've already got a natural philtrum ridge, some people haven't, but as we age that tends to flatten, and having just a little bit of a line here can help to kick out the top lip, which is quite a desirable look. So I'm just swapping again now from the cannula back to a needle. Okay, Lucy, you might find that this stings a little bit more than the other treatment I've just done for you, so my apologies. And this is just to, sorry, give a really nice shape so that when she's putting a lipstick on, it's nice and easy to get a good shape.
This would have fine lines around that area.
Absolutely,
as well.
Yeah. You can see she's just slightly flinching there a little bit. This just proves how easy it is with a cannula. And if you think a few years ago, all of these lip treatments were totally done with needles, so things are better now. You would have had to have had several series of injections, with a needle before, which did used to put people off having the treatment, but it really is a lot more comfortable with a cannula. And the last one here, just to define this little ridge here for her, which is nice and natural in Lucy anyway, but it's just enhancing what she's already got, and that's all the treatment done. So what I'm going to do is just give it a quick massage, just to check for lumps and bumps, but I think that's fine, and then we'll let her have a look. And she has got a little bit of swelling, but really it's not much, so I would suspect that these lips will go down probably no more than about 10%. So pretty much what she's got here is how they will be. And we're just checking for any uneven blobs and lumps, which I can't find. How did you find that, Lucy?
Yeah, really comfortable, really, you couldn't really feel, as I said, it was only when it first goes in that you do feel a tiny little bit. Other than that, as I said, the anaesthetic in both the balm and in the product is fantastic.
Can you give me one big smile like that? Lovely, and go like that. That's smashing. So that all looks really nice and even, and as I hope that you can see from the video that she's not swollen and not going out of here with misshapen lips, which nobody wants. And we'll just give her the mirror and she can tell us what she thinks.
Oh wow, brilliant. Like you said, they're still kind of really natural looking, but just with a bit more volume. They're brilliant. Really pleased.
I don't think they'll go down too much. I think that's pretty much what you will have.
Yeah, really great.
We can always add to it.
Yeah.
Can't take it away.
Really pleased.
Good.
Thank you.
Lovely. Okay.